Hi again, Dr. Tusek here. In this video, I'm going to tell you a bit of who we are at Cloud Medical and our why. Why did we build this practice? And what's the backstory and why do we do what we do? So a few years after medical school, I was sitting in my living room reading a medical journal. There was an article published by a physician named Barbara Starfield. She's a family doctor like me and also has a master's degree in public health. And in her article, she listed the top 10 causes of death. And I thought, yeah, I know those. We had to memorize them as med students. But what she was saying completely blew my mind. Her research showed that the third leading cause of death in America was our healthcare system itself. This was an existential shock for me. I was stunned, speechless. We were never taught that. We were taught the Hippocratic Oath, to do no harm. And yet here, plain as day, was evidence that we're not only not doing a great job with our oath, that we're in fact the third leading cause of death. And there's only two things that are more deadly in our country than our healthcare system: heart attacks and cancer. So this really affected me deeply, kind of brought me to my knees. And yet I witnessed so many of the miracles of modern medicine, the astonishing successes that we had in our profession. And I struggle how to reconcile that. How can we correlate the fact that we're so good in some ways while also being so profoundly dangerous? Well, over the next few years, the shocks just kept coming. The next one was discovering that healthcare bills were the #1 cause of bankruptcy in America. And then learning from the famous Stanford physician researcher, Dr. John Eudaimonics, that the vast majority of scientifically published research was profoundly flawed, biased, and generally false. And then I was learning that just in my lifetime, obesity rates in kids have gone up 10x. Autoimmune disease is up 30x. Autism has increased 300 times, and cancer is happening in younger and younger people every year. If we look at our entire population, taking people of all ages, 60% of Americans now have chronic disease. Nearly 60% of female college students are on psych meds. Suicide in young people is up 60% in the last decade. And 1 in 5 of our kids have seriously contemplated taking their life. It's so tragic. So what's going on? What's happening? Did we just stop investing in healthcare over the past few decades and just let everything go to hell? Is that what happened? Well, we all know that it's not quite that. In fact, in the 1970s, the annual per person healthcare spend was about $350 per year. And now it's up to $15,000 per person per year, which means we've gone from spending about 4% of our GDP on healthcare to about 20%. That's a fifth of our total economy, the biggest sector. The single greatest investment in our nation's budget goes to healthcare now. So we've massively increased spending while simultaneously we've gotten massively sicker. So look, I love celebrating the wins of our conventional medical profession, but we gotta get real. We gotta get real about what's going on. We gotta get real about what are the very likely reasons for this enormous tidal wave of sickness, most of which stem from how we eat and the various toxins that we're now chronically exposed to. From 300 million tons of glyphosate being sprayed in the US today, now it's detectable in breast milk, even in the rain. PFAS chemicals, the so-called forever chemicals, because they literally never biodegrade, are now present in 45% of the tap water in the United States, based on a recent study from the US Geological Survey. We've had the explosion of seed oils and highly processed foods. We've had the poisoning of our fish. We had the war on fat, the war on salt, the war on sunshine. All of these things are having a brutal effect on our health, and most people are waking up to the fact that more synthetic drugs and surgical procedures are just not going to address these catastrophes. So with all of this going on, flashback to 2008, I was completely excited and thrilled with absolute anticipation and eagerness after the announcement of the sweeping healthcare reform that was finally going to address all of these deep systemic problems. It was called the ACA, the Affordable Care Act. And I was working as an ER doctor at the time, and I remember reading through the summary of the ACA, and I was once again totally deflated. There was nothing transforming or reforming whatsoever. It was just an expansion of Medicaid, which is fine. But we needed fundamental change. We needed real change. And there were no improvements in that bill in how we do things. There were no improvements even in cost efficacy or cost efficiency. And from that sense of deflation came a deepening awareness of two things. One, politicians can't address our health crisis. They have no idea how. It has to happen on a grassroots level. And two, if we're going to make any impact, we have to be as intellectually honest and as intellectually precise as possible as to what's actually wrong before we can tackle the complex tasks of making any meaningful kind of improvement. It's the Charles Kettering quote, "A problem well stated is a problem half solved." We have to state the problem well. So I began to try to articulate the really deeply rooted problems within the actual source code of our healthcare system. I wrote them down in a document called the 10 Heartbreaks. 10 ways that the healthcare system broke my heart. I've done podcasts and written blogs. There's links to those in the show notes. It was honestly kind of a bummer listing out all of those heartbreaks. And I remember around that time hearing this voice, hearing this recording of a beautiful man named Martin Prechtel, a talk that he gave called Grief and Praise. And he described that grief and heartbreak are really the same things as praise and love, and that our level of grief is in perfect symmetry with the degree of our love, and that our collective heartbreak as a culture and society over the fact that our people on our planet have now become so sick is a direct manifestation of how much we actually love life and health and wholeness, and our immense collective desire to live in much better coherence with that. So the 10 heartbreaks of healthcare became not a source of sorrow or wallowing in helpless delusion, but really a prism of clarity, the inspiration for the 10 core principles of our practice at Cloud Medical that we published in a booklet called Salutogenic Eudaimonics back in 2020. We'll put a link to that in the show notes as well. So Cloud Medical is really a response to the health crisis. It's a sincere effort to help bring some sanity to a system that in many ways is not sane. It's an idea lab where we try to find innovative solutions for these massively complex problems. Much of it involves going back to the basic core values that we seem to have lost. We like to think of it in terms of the Bruce Lee quote. When he was asked, how do you become a champion in martial arts? And he said, well, that's easy. You take all the different schools that are out there, you take what's good in each of them, you add what's missing, and you discard the rest. So in our practice, we have a great amount of respect for the incredible tools of modern medicine. This really is the golden age of diagnostics. We now have tech that we've been waiting for our entire careers, especially for early detection and prevention of cardiovascular disease and cancer. So we definitely want to keep those tools. In fact, we want to incorporate them into our practice as fast as we can, because many times there's massive delays in how long it takes to incorporate them. But then we want to discard all of the profoundly flawed and pathological parts of our system and just be open about that and clear about what we need to change. And then finally, we want to add what's missing, or maybe better to say, recover what's been lost, which is the soul of medicine, the soul of healing, the soul of healthcare. So that's a bit about what we're about at Cloud Medical. Thank you so much for listening. We're honored for the privilege of joining you on your personal healthcare journey. All the best to you.